on Gen X Radio Suffolk, DAB across the county, the world online. 24 minutes past 11. You know how medical science has done a bit of a favour for a lot of procedures which are now so-called keyhole procedures where invasive surgery can be avoided. Well, that has moved on to our pets. I'm sure you'll be familiar with the so-called spaying. That can be quite an invasive procedure for a female pet. Well, keyhole surgery, or laparoscopy, has been introduced by at least one vet in Ipswich. The specifics on this are the head vet at Ryder-Davies, Tim Gamston, who joined us on the programme. Tim, good morning to you.
Good morning, how are you?
I'm very well, my friend. Did I pronounce that correctly?
You did, yes.
Fantastic, okay. Well, it's, as I alluded to, I mean, it's for a female pet. Spaying is quite an intrusive piece of work, isn't it? Or has been up until now. Yes.
So by spaying, we mean that we traditionally remove the ovaries and uterus.
Yeah.
Mainly so that the pet can no longer have puppies, but also there are some real major health benefits to doing that procedure. Specifically that they can't get infections in older age, and also to avoid certain cancers as well. And traditionally, that's quite a big surgery, like you alluded to. So we have to make an incision in the abdomen and do full open abdominal surgery, which is done very routinely, and it's a very safe thing that we do regularly. But we do now have the option of doing this procedure keyhole. And basically what that means is that we use two very small ports, incisions. One we use for our instruments and the other for a camera, so then we can see inside the abdomen. And it means that we don't have to touch any of the tissues. There's much less kind of trauma, there's no bleeding, and it's a kind of quick procedure. And typically the benefit is that those pets tend to then recover quicker. So they have two small little incisions on their tummy, and then within typically 48 hours, they're back to normal and can go back on their normal walks and back to normal life.
Wow. As you say, recovery is significantly quicker for it. And I suspect it's less traumatic for the animal as well, isn't it, really?
Well, yeah, exactly. Yeah, it is. So generally we find they don't need as much pain relief, and they're much happier and back to their normal selves quicker. A bit like people, when we have keyhole procedures, it's a lot less invasive than when we have to have full abdominal surgery.
The allegation is made by many that not enough of this is done. There are far too many, shall we say, unspayed pets in the county and in the country. Would you concur with that, Tim?
I'm not sure that I would say too many. I think that conveys a bit of judgment on people because for various reasons people decide whether they neuter their pets or not. And it's not necessarily the right decision for every animal. Sometimes there can be behavioural factors that mean that spaying them isn't the right thing to do, or obviously some people decide that they want to breed from their pets, or for various beliefs people decide that that's not what's right for their pets, and we would obviously completely respect that as a profession. We would just offer the kind of pros and cons, and then it's down to individuals to decide what's right.
Well, I suspect for many, and certainly at the moment with the crisis, cost of living going on, there might be a financial implication to this. So I'm bound to ask you, Tim, is the keyhole procedure any cheaper?
Yeah, no, that's a good question. I mean, no, it isn't. It's more expensive, and that's because it involves specialist equipment and specialist extra training to do it, and a lot more input from the practice. So it's a more expensive thing to do, quite significantly, really, from our point of view. And we try and keep the cost of spaying animals as cheap as we can to try and encourage people to do so. But the keyhole surgery is more expensive, unfortunately. And so we do still have a large proportion of people that decide to have the traditional spay, and that's a completely appropriate choice. But it's just an extra option that we do now offer. And especially for those kind of large breed bouncy dogs, we've found that it is really beneficial for a lot of our patients.
Yeah, okay, all right. Well, of course, that is happening with your good selves at Ryder-Davies. As far as you're aware, Tim, is this a general thing in the veterinary world, or are you quite unique in this?
It's a trend. So I think in the next sort of 10 to 15 years, it will be much more mainstream. Yeah. And I think more and more practices are now doing it for the benefits that we discussed. Probably, we try and be as up to date as we can be, and there's certainly a lot of practices aren't offering it yet, but they probably will be because it's the direction of travel. And there are other surgeries that we also can do now using laparoscopy. So, for example, taking a liver biopsy or doing retained testicle retrieval, which is also a common thing that we see in dogs, can now be done laparoscopically specifically as well. And so there are other surgeries that we can use these techniques for that can be really beneficial as well.
Wow. I mean, it's reassuring to hear that they're being looked after often quicker and better than we are as humans. I'm sure you wouldn't care to comment on that, but that's the sense I get from all of this.
Yeah, we do get that comment from clients sometimes,
yeah,
you know, that they wish they were an animal. But
yeah, exactly. Now, you alluded to it already, but just a reminder, if you could, to summarise, you would suggest that it's possibly the healthier option for a pet to be spayed, would you?
On the whole, for most female dogs, if they're not going to be bred from, then it would be probably our preference, for the reason that we do quite commonly see in older bitches that they can get a condition called pyometra, which is a life-threatening infection in the uterus. And also dogs that aren't spayed are much more prone to getting mammary tumours. And there is it's a contentious issue, and there's a lot of people that really strongly for and people that are really strongly against. But when you look at the literature and the published data, overall, those dogs that are spayed do tend to live longer than those that aren't. And there are certainly some contraindications and some complications that people need to be aware of. But on balance, it's generally our preference. But like I said before, it really is down to personal choice. And so we wouldn't judge anyone who decides not to. And that's also a really valid choice for various reasons.
Absolutely. Well, delighted to catch up with the head vet at the Ipswich Ryder-Davies, Tim Gabster, on the programme, now with keyhole surgery for spaying and possibly other procedures going forward as well. Tim, great speaking to you. Take care, my friend.
All right, thanks a lot. Bye.
The James Hazel Show, Gen X Radio Suffolk.